Okay, hi everyone. This is gonna be for my remediation assignment for my fundamentals of public speaking class with Professor Ryan. So my assignment is gonna be on effective communication strategies in nursing and enhancing the overall patient-centered care. Um, Communication, in my opinion, is one of the most important skills or strategies that you need in this profession of nursing because so many things can go wrong when communicating. It's important to effectively communicate to your patients. It's important to effectively communicate to your other nurses, your techs, your CNAs, your doctor who is going to be prescribing the meds. You need to double check that and make sure and communicate that everything is correct with that and how they want to give it to you. It also helps you avoid like a lot of medical errors, miscommunication, any barriers that your patient has understanding, things like that. I'm going to be talking more about that deeper into the slideshow. Oh, I thought it would go. Sorry. Um, one second, trying to figure this out. Okay, there we go. Sorry. So my first slide's going to be the agenda, and this is everything that I'm going to be speaking on. I'll briefly explain why communication is so important to nursing. Then I'll discuss key communications, strategies that nurses use when interacting with patients. And then I'm going to talk more about like the patient safety, cultural competence, in certain healthcare settings and patient care settings, and also cover like the common barriers of effective communication and why and how nurses can overcome these certain challenges. Okay, so the first one is going to be the importance of communication in nursing. I have a few pictures here to go along with all of the research that I have to the left of the screen, to the left of me at least. So communication is a very fundamental part of nursing. It's one of the first things that you are learning. Clearly, that's what I'm learning right now in one of these classes. But nurses are the ones who spend the most time with patients, so our communication is especially important. It is very, very, very important. And all of the effective communication helps nurses gather information, have the patient trust them, and be willing to listen to all the patient care directives that they have for them. Um, and it shows, like research shows that patients who or nurses who step forward and communicate more with their patients on their needs, their wants, stuff like that. Sorry if you hear my dogs. I apologize. Um, and stuff like that. Right. So key communication strategies in nursing. I have again some pictures on the right and more information on the left if you want to read while you're listening. So one of the most important communication strategies in nursing is active listening. Active listening involves giving your patient full attention, disregarding anything else and listening and fully being in the zone with your patient. They often feel very, like heard. And when someone feels heard and understood, they feel more trust and more Hey Moose, don't please. Um, I'm sorry. Encourage them. It encourages the patients to give more information to that nurse or to the doctor, and overall that can help the patient care. Another key strategy, my second point here is going to be the clear and simple language. Nurses really shouldn't use big medical terminology when talking to patients because again, they don't have the same education and overall like training on this stuff, so they don't know. Like you could say bowel movement and like they might not know what that means, but it really is just like using the restroom, doing a number two. Um, So yeah, and then the third point I have here is empathy and nonverbal communication. These ones are very essential because your body language could also give away that you're not listening or like you don't care as much as you do. Moose, stop. Sorry, my dog. So overall of these strategies like closely align with all of the public speaking, the fundamentals of public speaking like principles that we discussed during our class and how we can deliver like information clearly and confidently. Right, communication and patient safety. So, effective communication plays a critical role in patient safety. So many medical errors stem from miscommunication, like unclear instructions, incomplete information, like when you're like shift change, like when you're supposed to give report to the next nurse, like if you miss something, it could really make a really big difference in your patient's care. Um, like for example, when nurses explain medications, they need to be making sure that they explain this clearly, confidently, and very in depth because there's other there's other like medications that your patients can mix and it could cause real harm to them, and they may not know unless you communicate to them how important it is to not mix these medications or to take this medication at a certain time or with food or without food, stuff like that. The instructions are very, very, very important. All right, the next one, barriers of communication and solutions. So common barriers, time like heavy workloads, stressful work environments, and a big one, language differences, and especially emotional stress of the nurse and the patient. So despite the importance of effective communication, common barriers can include all the things that I just said, and like the way to address these challenges, they can provide communication skill training, whether that be like a class in school or when you get hired. Um, there's also a method that I included into this called the teach back method, which confirms patients fully understand where the nurse kind of explains, okay, so I'm gonna let's for example like blood draw for example, like okay, I'm going to take this needle and I'm going to sterilize it. I'm going to sterilize your arm. I'm going to have you straighten your arm and squeeze, the ball that they give you, and that you like basically you're explaining to a 3-year-old, but it's not like a 3-year-old. You have to explain in someone like an average person would understand, in language that an average person would understand. And if you don't know the language, there are so many translations on your phone. There's meta glasses. There's so many new technologies that you could use for those types of things. And there's also in-house, like in-person, translators within the hospitals as well. And so overall, the inclusion, effective communication is a very, very important component in like a high quality nursing care. Like strategies is active listening, clear language, confidence and empathy can help build like strong relationships with your patients. And the principles of public speaking, such as like the audience analysis, clarity, confidence, organization, these are directly applied to nursing because in charts, you need to be organized, clear, and effective. And these are all the things that we learned in this class. And so basically, I hope you enjoyed my my presentation on like effective communication with nursing and patient care. This is my reference slide with my 3 references. I used the textbook and 2 other scholarly articles for this. But please let me know any feedback. Thank you so much for listening, and I appreciate this chance for a remediation assignment. Thank you so much.